and thank you again for joining us. And I'll hand it over to Dr. Adam Leventhal, the Director of the Institute for Addiction Science.
Thank you, Dr. Dahlquist. I'm Adam Leventhal. I direct the Institute for Addiction Science here at USC. We're really excited that you joined us. We have a speaker series and really an exciting speaker today, but just a little bit about IAS for those of you who don't know much about us. We are a university-wide interdisciplinary research and education group focused on addressing addiction, the addiction epidemic from all sorts of different angles, from cell to society and policy as well. We have representatives from A+ schools. So we're hoping that folks who join us now will join us for future lectures and other types of community engagement activities that we execute. And so we're just really excited. So let me go ahead and introduce Dr. Steinberg. It's my pleasure to introduce Jane Steinberg, as she is faculty in the Department of Preventive Medicine at the USC Keck School of Medicine here. Dr. Steinberg's been working in all phases of public health, from practice to education to research. So she really kind of talks the talk and walks the walk on multiple levels. And so I think her presentation is going to be really exciting. Her research interests are adolescent health, tobacco control, and cannabis regulation. Also, she's interested in health disparities. She has a number of different projects right now, including a grant that's funded by the Tobacco-Related Disease Research Program, looking at proximity to cannabis retailers and how that might affect adolescents' use to cannabis here in our state. And she's involved in a number of other different types of programs on the public health practice and education side. So, and she's been in California for a long time, has a bachelor's in psychology from UC Davis and MPH and a PhD in community health sciences at UCLA, but we still love her even though she's here at USC now. So without further ado, Dr. Jane Steinberg.
Thank you, Adam and Kristen, for that lovely introduction. So hi everybody, and good afternoon, and hope everyone is well and staying safe and healthy. So today, as Adam said, I'm going to talk about public consumption of cannabis and some potential threats to smoke-free environments in cannabis-legal states. First, I'd like to acknowledge my collaborators, Lourdes Bayasconde Garbinati, Jennifer Unger, and Michael Cousineau, co-authors here at Keck. And a key contributor and our collaborator was Cynthia Hallett and Liz Williams, who are at the American Non-Smokers' Rights Foundation. This is an organization in Berkeley that it's a national organization that helps local jurisdictions craft smoke-free ordinances. And we will be reporting, I'll be talking about results from a study we conducted that was published in the American Journal of Public Health in December, this last December. So to give you a brief roadmap, I want to talk a little bit about the background on cannabis legalization in the US, some key challenges in regulating public cannabis use, talk a little bit about cannabis and tobacco use among youth, since that is a target group that we're very interested in, and particularly for the health effects of cannabis and tobacco. Talk a little bit about our study methods that we use, the results and that we came up with, some ongoing health concerns with public cannabis use, some ongoing challenges, as well as some recommendations and policy options. And there's also a few resources at the end of the talk. All right, so to start, let me move this out of the way. Okay. Since 2012, over 1/2 of all US states have legalized cannabis for either medical or recreational use. And from here on out, instead of recreational, I'm going to call it adult use, since that is the new term that's used for what used to be called recreational cannabis use. A key challenge, however, for cannabis legal states and their municipalities is establishing where residents can legally smoke the product. either smoking cannabis or consuming aerosolized or vaped cannabis. A growing public health concern that we found is that states and localities are now creating exemptions in their state or local smoke-free laws through ballot measures and local ordinances that are allowing public cannabis smoking or vaping. And this is a problem because these actions can weaken a city or state's smoke-free laws. They can expose the public to secondhand cannabis and also renormalize smoking and vaping, which again, we particularly have our eye on youth. So we conducted a comprehensive review of state smoke-free laws and cannabis use allowances in the first US states that legalized adult use cannabis. A little more background. As we know, cannabis, both medical and recreational or adult use, is still illegal at the federal level. Medical use of cannabis is allowable and illegal in 33 states. Since 2012, 11 states, Guam, and Washington, D.C. have legalized adult use cannabis for individuals 21 and over. And these states are Alaska, California, Colorado, Illinois, Maine, Massachusetts, Michigan, Nevada, Oregon, Vermont, and Washington, as you see in the dark green on the map on the right. And what cannabis legalization for adult use means is that personal use is allowable. You can grow it on your property. If you have private property, there's limits on how much you can grow. You cannot sell it, but you can give away certain amounts, and it really varies state by state. Cannabis legalization also allows relief for past cannabis-related arrests and conviction. This differs from state to state, but most, if not all, cannabis legal states for adult use have this in place, some sort of relief for arrests. And for what we're going to talk about today, cannabis legalization establishes a regulatory framework for the commercial and retail market. So that would include manufacturing of cannabis, distribution, sales, like a cannabis dispensary, if you have a lab. So there's a number of different categories of what we consider the commercial retail market. And 8 states, as denoted above by the asterisks that I made, these 8 states have already established cannabis retail stores or dispensaries for adult use as well as medical use as of May. And more are growing. Maine is on its way to establishing stores, as well as potentially Vermont. Everything is sort of on hiatus with COVID, but these other states should be, the ones that do not have an asterisk will have sales in the near future. All right, so a key challenge in regulating cannabis use that I want to focus on today is where people can use. So public consumption of cannabis conflicts with state smoke-free laws that prohibit smoking or vaping in public places, such as bars, restaurants, any other public places, and federal and state laws that prohibit cannabis use in workplaces, public places, and in multi-unit or federal housing. So allowable cannabis use in cannabis legal states are often confined to one's private property or outside the view or smell of the public. Landlords of private multi-unit housing can prohibit medical and adult cannabis use on their property. Residents who live in publicly funded housing, such as Section 8 or other kinds of public housing, are prohibited from cannabis use on the property, and they risk fines and eviction, even if they're using it medically and even if they live in a state where cannabis is legal. And there's some really important health equity implications for these same communities who've been negatively impacted by US drug laws. And I'm going to talk a little bit about more of that later. But this is a key issue for states. All right. So another key challenge in regulating cannabis is protecting the public from what we call secondhand cannabis exposure. So although the research is really evolving in this area, we do know that exposure to secondhand cannabis products, and when I say products, I mean cannabis smoke, cannabis vape, impairs cardiovascular function, and it increases the risks of coronary heart disease or stroke. We know that secondhand cannabis products contain many of the same carcinogenic compounds and fine inhalable particulates that are found in tobacco smoke. And exposure to secondhand cannabis products can cause or exacerbate respiratory symptoms, especially for people that already have those conditions, such as asthma, bronchitis, and COPD, chronic obstructive pulmonary disease. And heavy passive concentrations to marijuana smoke can result in measurable concentrations of THC in non-users' blood serum and urine. However, again, the research is still evolving in this area, but these are known risks. Another key challenge in regulating cannabis is protecting youth. So we know that as the trend towards legalization across the US grows, there's a public perception, and even more so among youth, that cannabis smoke and vape is less harmful and more socially acceptable than tobacco, with fewer perceived consequences than for alcohol. So although in some ways cannabis smoke, the harms may be different for cannabis than they are for tobacco, when you're talking about youth, a message that many public health people have been giving is that both are unhealthy, whether it's cannabis or tobacco. Part of the problem is that these lessened perceived risks of cannabis-related harms may result in earlier age of use, greater frequency of use, and reduced motivation to cease or reduce use. And this is something that people are tracking very closely now. The recent epidemic of vaping-related acute lung injury and death among youth and young adults has been associated with both THC and nicotine vaping. Now we know that it was the mineral oil, perhaps that was associated with some of these injuries. It still lends credence to the fact that vaping is not a safe activity and is still being monitored and studied. We also know that chronic cannabis use during adolescence is associated with learning and memory deficits, dependence and abuse, and psychosis. So there are some real health issues with cannabis that are often not known to the public. All right, now I briefly wanted to talk about cannabis and tobacco product use among youth. We know that the popularity of e-cigarette and vaping devices among youth and increased rates of vaping have steadily increased, with the most significant rise between 2017 and 2018. Adolescent co-use of tobacco and cannabis has been found to be greater than tobacco use alone. And a lot of people have had questions about what are the impact of state cannabis policies on youth cannabis use. There have been mixed results. Some studies have found a higher prevalence of adult, but not adolescent cannabis use in states that had medical cannabis laws, whereas other studies have found no change or a decrease in youth cannabis use. So this is an area that's ripe for study. Taking a look at, this is data from Monitoring the Future, which is a national representative sample of high school youth, middle and high school youth. This is the percentage of students that reported marijuana, cigarette, or vape use in the past month who were 12th graders. And as you see, the steady decline of cigarettes is happening. Overall marijuana use fairly consistent, but a big spike between 2017 and 18 in vaping products, whether it's vaping nicotine or vaping cannabis. So this is something that public health researchers are keeping an eye on, is what happens with the future here of vaping, nicotine, and cannabis. And a number of our faculty here at the Addiction Institute are studying this. All right, so now I want to go back to our paper to talk a little bit about our study methods. So to understand the current landscape of smoke-free and cannabis policies, we assessed current smoke-free and public use laws in the first 8 states that legalized adult use cannabis, who also had established dispensaries, which are listed here. We coded state smoke-free indoor air laws for how comprehensive they were, for any allowable exemptions that were in their state smoke-free law, as well as any state law changes between 2018 to 2019, such as the addition of e-cigarettes that were added to a local or state smoke-free law. And cannabis consumption laws were identified through, we conducted Google and Nexus searches of state statutes, administrative laws, ballot measures, state bills, and county and city ordinances that were enacted or in place between 2018 2019. And the searches that we limited were indoor smoke-free indoor air requirements, allowable exemptions, as I noted, to a state smoke-free law, and I'll talk about that in a minute, and any allowances for cannabis smoking or vaping in dispensaries, consumption cafes, and cannabis tourism venues. Okay. Oops. Okay. So our first set of results is here. And also I wanted to make note that when I talked about a comprehensive smoke-free law, the CDC defines a comprehensive law if it prohibits smoking and vaping in the following areas: work sites, restaurants, bars, and gambling establishments. So this is the model that we were using to assess how strong a state smoke-free law was. So first we have the results from smoke-free laws. As you can see here, of our 8 states, the majority are what are considered 100% smoke-free. So smoke-free is prohibited in workplaces, restaurant, bars, and gambling sites. However, I want to draw attention to Alaska. So the state of Alaska, although it does prohibit smoking in workplaces, restaurants, bars, and gambling venues, it also allows local jurisdictions the ability to opt out of the state law, which is a huge problem for smoke-free environments. So it doesn't get the 100% smoke-free designation for that reason. Also, if you take a look at Nevada, their bars and gambling establishments are exempted from the state smoke-free law. As you know, Nevada has the majority of casinos in the United States. However, the city of Las Vegas bans smoking in its bars and gambling establishments. So this is also to talk about kind of the importance of local control that is in all of these states, I believe, cities, local jurisdictions have the ability to enforce stronger laws than what the state might enforce or what might be in the state law. So if you also take a look at the allowable exemptions to the state smoke-free law, all states here, with the exception of Illinois and Washington, allow smoking and tobacco, and for as long as we have them, vape shops. Interestingly, most states also allow smoking in a percentage of their hotel rooms, unless it's banned by a local business policy or a local ordinance. And if you look in Illinois, smoking is allowed in private rooms or semi-private rooms in nursing homes and long-term care facilities, which I thought was very interesting. Again, a city can enact its own provisions, but state law does allow for this. Also, smoking, there are exemptions like in Oregon for cigar bars, private clubs, and in Nevada, casinos, brothels, hotel rooms, statewide, smoking is allowed. Again, a local jurisdiction can preempt that or can ban it. Okay, so commercial settings here that we decided to look at where there's indoor cannabis consumption are kind of 3 main areas. I categorize them. One is consumption lounges. These are places where people can go and smoke cannabis in a lounge environment. Typically, alcohol cannot be sold or food cannot be sold at these lounges, but there is indoor smoking and vaping. We have one in West Hollywood called the Lowell Cafe. If anyone has been, it's very interesting. There's lots of smoking inside, but also outside primarily. There are places in the Bay Area, and more consumption lounges are growing. So that's one area that we were looking at. The second area is dispensaries, where people are buying their cannabis products. The cannabis industry has been very instrumental in getting states to allow indoor cannabis consumption in dispensaries for the reason so that people could sample the products. Whether it's edibles, whether it's vaping, whether it's smoking, dispensaries are a place where cannabis smoking can occur. And another large category we created was called cannabis tourism venues. So Looper is a company that, and there's other companies that are called cannabis buses, where people can smoke and vape freely in a bus, where they go from dispensary to dispensary. And there's some real concerns about, keeping the driver safe and employee safety precautions in these environments. There's a whole range of other cannabis tourism venues. You can Google them. There's cannabis yoga. I can't imagine doing yoga and smoking cannabis at the same time, but that's just me. But there are a lot, there are a lot of people who are interested in sort of expanding the places where tourists are coming, particularly cannabis legal states, to smoke cannabis. There's a company or multiple companies called Puff Pass Paint, where you can smoke your weed while you are painting. These are businesses, and they are throughout the United States. So cannabis tourism is, and will probably be a big, and already is, a growing industry. So these are the three areas we were interested in, where there's indoor smoke, potentially indoor exposure. All right, so here's a table of our 8 states. And what we see is, with the exception of Nevada, all states include vaping devices in their state smoke-free law. Now, this is important because this loophole for Nevada means that potentially cannabis smoking and vaping could be allowed where smoking or vaping is currently allowed. So that's why a lot of times it's important to close smoke-free loopholes to make sure that if cannabis is going to be legal in a particular state, that smoking or vaping wouldn't be in these areas to potentially cause exposure. All states, however, have on their books a prohibition of public cannabis smoking or vaping. So for example, in California, Proposition 64, which is the initiative that legalized cannabis, cannabis use is banned wherever smoking is prohibited. And that's often the case in other states as well. However, there have been a number of carve-outs and exceptions. This is what we're really focusing on. So as I noted before, there's been a lot of advocacy and lobbying by not just members of the cannabis industry, but users as well, who want to be able to sample products inside their dispensaries before purchasing them. So, but there has been a lot of lobbying at the state level in California and in other states as well. So as you see here, Alaska, California, Colorado, and Illinois, per local control, meaning if a local jurisdiction allows it, there can be on-site smoking or vaping in a cannabis dispensary. Similarly, in social consumption lounges, people can smoke and vape unless it's banned by a local ordinance. And in terms of indoor cannabis tourist venues, California, Colorado, and Illinois allow this for now. Again, if approved by a local jurisdiction. So as far as I know, with the exception of Alaska, that recently, this is very recently, one of their local jurisdictions voted against having a consumption lounge in their city. I don't know offhand of other cities who have actually banned them thus far. Okay, so but this is, the red check marks I think are what are really to focus on, is seeing where potential smoking and vaping is being expanded in these indoor environments. And I will talk a little later about some of the public health issues involved with that. All right, I will talk now. So in terms of health concerns with cannabis, looking at consumption businesses, we know that states that have carved out exemptions to their smoke-free laws to allow cannabis in businesses are still, however, required by law to address the issue of indoor exposure to secondhand cannabis on their premises. A common practice now that we're seeing in dispensaries and consumption lounges is the creation of ventilated indoor lounges that are separate from the main retail space. And this is actually something also that the tobacco industry did for a number of years when smoke-free space, when it was clear that secondhand smoke was causing detrimental health effects, the industry tried to create some sort of a ventilation program to still allow smoking inside. But ASHRAE, which is the American Society of Heating, Refrigeration, and Air Conditioning Engineers, this is the international standard setting body for indoor air quality, has affirmed that installing barriers or ventilation systems to remove secondhand cannabis is not an effective method for removing all the health risks due to potential secondhand exposure. They also put out in their position paper that you see up here in the corner that there's no safe level of exposure to secondhand cannabis smoke or aerosol, and that cannabis smoke and aerosol should not be allowed indoors at all. So some of the issues that this brings up are worker exposure to cannabis byproducts in dispensaries and consumption lounges, because workers are very close to patrons when they are smoking or vaping. There's also the issue of bus driver exposure in cannabis tour buses. There was a challenge, I believe it was in the city of Denver, that was cited a while back for the city violating its own indoor air laws by potentially exposing bus drivers to cannabis, secondhand cannabis during these looper and tour buses when they were operating. But the industry came back and proposed having a thick glass wall between the driver and the patrons. I believe ASHRAE, I think it was ASHRAE that weighed in on this, or maybe it might have been another organization that said that glass is still not sufficient for fully protecting workers. But this issue is ongoing in terms of occupational health exposures to secondhand cannabis, and it's not been resolved yet. I'm losing my voice. Okay. Another area that others have worked much more on than myself, but absolutely deserves mention here, is some of the health concerns and use of cannabis in multi-unit housing. So we know that secondhand smoke, whether from combustible or aerosolized tobacco or cannabis, spreads throughout multi-unit dwellings. A recent study here at USC in our Department of Preventive Medicine of 251 residents in LA County that lived in multi-unit housing, over half of them experienced smoke from tobacco and cannabis entering their unit. This is Yanet Rodriguez and colleagues here at Keck. Multi-unit residential property owners, as well as public or other subsidized housing owners, do have the legal authority, though, to make their properties smoke-free. Of note is that there is no official citywide policy in LA at this time that prohibits tenants from smoking in privately owned apartments and condominiums. So there can be individual business policies, but so far in the city of LA, we don't have a policy here. Okay. Some ongoing challenges with maintaining smoke-free environments. So still, state and localities are continuing to grapple with where residents can legally consume cannabis without violating smoke-free laws and compromising public health. Whenever we talk about smoke-free environments in cannabis, there are very important social equity and social justice issues. We know that cannabis-related arrests and incarceration rates have been and continue to be significantly higher among Black and Latino communities compared to their white counterparts, despite similar rates of cannabis use. And at the same time, though, our analysis documents a growing trend for states and localities to allow exceptions for indoor public cannabis use in venues that are currently required to be smoke-free. So I also want to add the asterisk here. This isn't about a person's right or ability to use cannabis for whatever reason. It's more about exposing others to the secondhand byproducts. We also know that and concerned that allowances for public cannabis use may roll back existing smoke-free protections to protect public health, and maybe renormalize smoking, which is particularly a concern for youth. So looking at what's ahead for indoor cannabis consumption in businesses, thus far 3 additional states, Alaska and Massachusetts and Nevada, are planning cannabis consumption lounges. They have, they're working on crafting legislation. San Francisco recently voted to waive its smoke-free laws to allow cannabis smoking at special events, and allowing cannabis smoking in dispensaries that are located in multi-use buildings. Now, this is important, the multi-use buildings issue, because if it's not a standalone building, if it's a multi-use building, smoke and vaping products can waft into other areas of the building. Also, just to kind of keep a note here is that the state of California and Colorado have had some of the strongest smoke-free laws in the country. So it's really interesting to also see, and a little worrisome, that some of these very strong laws are being eroded with the allowances of cannabis use in indoor environments, in business environments. The city of Eureka in Northern California recently voted to allow smoking lounges at cannabis retailers with ventilation systems, using the ventilation argument. And the city of Berkeley, where I grew up, has adopted recommendations to allow consumption lounges for on-site smoking in cannabis retailers, and to roll back the city's 2007 Smoke-Free Parks law to allow cannabis smoking and vaping during special events in a city park. And the state of Colorado recently, their House of Representatives recently passed a hospitality bill to broadly allow cannabis smoking and vaping in a wide range of indoor businesses. And I think I might have skipped statewide bill. If you go up to the top, California has a statewide bill, AB 1465, which is being considered to allow cannabis smoking, vaping, and licensed cafes and lounges in venues that are currently smoke-free. So this is sort of what we're seeing. This is a snapshot of what we're seeing in terms of allowances for cannabis use in previously smoke-free environments. So a few recommendations and policy options. Public health officials and tobacco control advocates have suggested amending language in state laws regarding the prohibition on outdoor cannabis use while retaining strong smoke-free indoor air rules. So for example, consideration could be made for a standalone building to allow sampling at like a standalone cannabis dispensary or lounge, to allow sampling of products or use in an outside area where workers and patrons would not be exposed to secondhand cannabis smoke and aerosols. And as an aside, there was a recent meeting with the CDC's Office of Tobacco Control with a number of state health department and tobacco control advocates talking about ways that cannabis could be used safely, not exposing others to secondhand smoke or vape in cannabis legal states. But that kind of came to a screeching halt, understandably, in light of COVID-19. But these are discussions that are happening throughout the country. Another recommendation is working with owners of multi-unit housing and tenants to either allow cannabis use outside of one's property or using another form, such as edibles. I believe it's the city of San Leandro is working on such a policy. But this also would necessitate education of law enforcement on new rules and policies, and to prevent disparate treatment of communities that have been harmed by US drug laws. So there's a lot of work that needs to be done in the multi-unit housing area, as well as in the residential space or in the business space. So finally, local and state policy should work to denormalize all forms of smoking and vaping to limit some of the negative health impacts of use and exposure to secondhand cannabis. I didn't include the citation here, but this is a citation from the Truth Initiative, which does a lot of work on tobacco as well as cannabis use among youth. It's a youth prevention organization. Targeted tobacco and cannabis prevention strategies are clearly needed for youth, particularly in cannabis legal states. Most youth have seen large billboards, at least in LA and in the Bay Area, certainly advertising cannabis. There's, cannabis marketing and promotion is everywhere. So these targeted strategies are really needed for youth, particularly in the area of cannabis, as well as tobacco and e-cigarette and vaping. And COVID-19 also highlights the health impact of breathing shared air in workplaces and public places, such as casinos, bars, and cruise ship. So businesses now are seeing that they have really been impacted by population health risk factors, as well as the urgent need to rethink some of their assumptions about the health and economic benefits of going smoke-free. So I think this is an interesting time as we move ahead to see what these businesses do. And I provided some resources here, some model language for multi-unit housing through Americans for Non-Smokers' Rights, as well as the Public Health Law Center, which has some excellent resources and some information on secondhand and third-hand smoke and vaping products for you. And here's my contact information if you have any questions.
Thank you, Dr. Steinberg, for that excellent presentation. Now is the time to, if you are an attendee, raise your hand with any particular questions you might have. And I will unmute you and you'll be able to join us and ask Dr. Steinberg your question. I do have a few here though that I'll kick it off with. First question, how do you determine or think cannabis policies might change with COVID-19 concerns to smoking and vaping and outdoor smoke-free laws?
That's a really good question. I think from people I've been talking to who work in the field of tobacco control in particular, I'm not sure about the cannabis world, but in tobacco control, there is a heightened public awareness that people are responsible for not exposing others to respiratory risks like vapor smoke. I actually think that's true in the cannabis industry as well. And people are finally starting to ask, what does indoor air quality look like and how do we presume that it's safe? So for example, casinos, following COVID-19, casinos in Kansas are now going smoke-free. Kansas is one of the states that was most resistant. So we're already seeing some changes. I think there's a big shift in what's considered acceptable to being exposed. You know, businesses are doing deep cleaning, right? We hear this term deep cleaning with COVID-19. So from a business perspective, why would you introduce smoking or vaping and increase risk of disease? So again, the future, we don't know, but that's what I'm thinking for now. And that's what I've heard.
Okay, thank you, Dr. Steinberg. On that same vein, we have a question about the difference in implications of smoking versus vaping policies. Are there distinctions between the two, and should there be?
That's another excellent question. So I go back to the ASHRAE standards that I was mentioning before, the American Society of Heating Refrigeration folks. So their standard for acceptable indoor air quality is clean indoor air, not less harmful air. So they really don't make a distinction between smoking versus vaping. I mean, we know that all of these consumption methods create unsafe levels of fine particles that could penetrate deep into the lungs. So organizations such as ASHRAE, the Public Health Law Center, Americans for Non-Smokers' Rights are kind of not making that distinction between smoking and vaping for policy purposes.
Thank you. We have a question here. What is the best wording for multi-unit housing ordinances when trying to include marijuana and vaping?
I would refer the questioner to that list at the very end that I presented, resources for multi-unit housing for the Americans for Non-Smokers' Rights, as well as the Public Health Law Center, that have specific language for what would be considered best practices in an ordinance.
Alrighty, thank you. Here we have another one. What strategies have been used to successfully advocate for smoke-free environments?
Well, the most important strategies have been state and local smoke-free laws. I think there's been a lot of community organizing, and we're seeing it also now around vaping and tobacco flavor bans. So I think really there's been a number of successful strategies, but primarily working at the city level, the state level, to create changes. the Center for Tobacco Policy and Organizing, by the way, is an excellent body that has strategies for successful advocating of smoke-free environments. That's one resource.
Thank you. And I'll be sure to share the slides with the resources with everyone who attended today. So there's an obvious lag time between authorizing cannabis use and then fortifying the smoke-free laws. Is that what you expected? And what are some alternatives for the future to maybe mitigate that lag time?
So really interesting. So I don't know the actual answer to this, but what seems to be happening is that there have been parallel tracks. So enforcement for smoke-free laws has been done by one unit. It's typically done by tobacco control or enforcement divisions within a local government. Cannabis enforcement has often occurred in a different division. So there's not often parallel enforcement by any stretch. You'll have a police force doing some enforcement. You'll have a local jurisdiction doing a different. So in terms of authorizing cannabis use to strengthen or to fortify smoke-free laws, it's not clear to me that those have been happening in parallel. Now, with COVID-19, discussions have been happening at local health departments in their tobacco control programs for combining cannabis and tobacco enforcement somewhat. But I think it still remains to be determined.
Thank you. We have an attendee with a question. What are the implications in terms of using edibles in a smoke-free location? Would there be any other dangers? Has there even been discussion about this?
Great question. Yes, edibles solve the problem of exposing others to smoke-free, to smoky or vaped environments. Obviously, the issue with edibles is controlling the amount, and it brings up a different issue when we talk about public transportation, right, and driving. But in terms of smoke-free, that is absolutely being discussed, as I mentioned before, in multi-unit housing situations and others where people either need to take edibles medically or want to. But that does address the secondhand issue. If I were a business though, and I was not allowing on-site consumption, but was allowing, edible use in on-site, absolutely there should be some plan for making sure that people are not, real out of their minds and driving home. So it brings up a different set of issues, but just not the smoke-free ones. So that is a good one.
Okay, thank you. You talked about multi-unit housing a little bit already, and some of the policies and enforcement, but what are the vulnerabilities in that enforcement? Let's say for even people who are in or seeking recovery but relapse, and this is a new housing situation for them. What does that look like?
That's an excellent question. I think there needs to first be a lot of education of multi-unit housing. First of all, there needs to be some standards because cannabis legalization is relatively new in a number of cities, relatively. I think there needs to be some standards for best practices in multi-unit housing situations, including ones where you have people in recovery or you have obviously underage youth. So I think standards and education, there has been a woeful lack of education in certain cities of multi-unit housing providers, what they should be doing, where the resources are. That's just my first response.
Who do you think would be ultimately responsible for that education? Is it the multi-unit housing themselves, or would it be, the city or the, academia?
All of the above. I mean, it would be just like health departments monitor food quality, right? And pesticides, so too, I see that as the role of local governments or state governments as well, working with academia to adopt best practices and also work on the enforcement piece.
Okay. We have a question about driving under the influence, which I know there's been a lot of change to the way that that's been done recently. What are the laws for driving under the influence, and are there ways to test for DUI?
I don't know, to be honest, what the specific laws are. I mean, I can look them up and get back to this person. There's, you know, for a long time, there's been issues with how to gauge impaired driving, right? Because THC levels vary from person to person. They can stay in one system for a long time, but you may not be impaired. So there may be more updated information on effective technologies, but impaired driving is an issue.
Mm-hmm.
I'm not an expert in that area, but I could look it up for sure.
Yeah. I know that there, at least with LAPD and a few other police departments, there's drug recognition experts, and they train them to be able to fairly accurately detect what drug an individual who is driving might be under the influence of. I don't know the percentage of how accurate that is, or if that holds up in the court of law or anything like that. But on a related note, are there campaigns to educate populations about signs that they are too buzzed to drive?
I saw one when I was driving. I've seen some, and I think it's through the Department of Transportation, if I'm not mistaken. I've seen a few bus benches in small letters as I was driving by. So that must mean that there are campaigns. I'm just not fully aware of them.
Good. There should be campaigns. We have another question here. Prop 65 requires signage in retail establishments, which warns about the fact that marijuana smoke can cause cancer. Is anything happening to get this law actually enacted?
To get Prop 65? Wait.
The cannabis part of Prop 65 enacted.
I'm not sure. I can actually check with Cynthia Hallett, who has been working on this issue, and get back to you.
Okay. We have a comment from Yaneth. Thank you. She has an answer for us. Rethinking Access to Marijuana has some social media campaign materials related to smoking and driving. So I imagine we can just look up Rethinking Access to Marijuana and find some materials if we're interested in that. We have a question from Adam Leventhal. Adam is available.
Hi.
Hello, Adam.
Sorry for those who can't show their face. Great talk, Jane. Could you talk a little bit more about cannabis concentrates? I think that's, you know, of all the various new trends in cannabis, you know, what are your thoughts there as a kind of public health scientist and public health professional about what are the dangers and what are the potential policies and other types of population level interventions we might consider to prevent what I think could be something very concerning as more and more people use these really high potency products.
Absolutely. You know, I don't know if you're talking about from a secondhand smoke or vape perspective, Adam, but
for anything, you know what I mean? Yeah, I guess I'm asking you to speak a little bit outside of the topic area too, but yeah, certainly secondhand might be a piece of it, right? But you know, just kind of where your thinking is at, you know, on this particular product class.
Sure. Where my thinking is at is that we are woefully in the dark about some of the health impacts of concentrates, particularly among youth. So, you know, that's really an area that's ripe for research. Oftentimes youth don't know what the concentration level is that they're ingesting. The state packaging and labeling requirements often I think are very confusing when people are ingesting way more than they are aware that they are ingesting. So, I mean, the short answer, Adam, is that that's an area that we absolutely need to be focused on in terms of understanding it better.
Thank you, Dr. Steinberg.
Sure.
We have a couple more here for you. Have any studies been done to determine what percentage of California adults are aware that marijuana smoke can cause cancer?
What percentage? I'm trying to think of surveys that have been done on cannabis related to this topic. And I'm not sure.
Mm-hmm.
I can look it up. These are all really good questions.
That sounds like a really good research avenue.
That's an excellent.
I would imagine whatever's out there, it's probably not enough to understand kind of the public perceptions on the intersection of cancer and cannabis.
Well, and more broadly, when I was talking earlier about there's this perception that cannabis is healthier, you know, and sort of making this equivalency to tobacco that, you know, compared to tobacco, cannabis is this. You know, there's been so much advertising and promotion of the health benefits of cannabis that I think there's a lot of confusion in the public mind about what are really the health impacts, coupled with a glaring lack of research in this area because of the federal prohibition. So yeah, lots of areas that are ripe for study and for learning. And the denormalization and commercialization of cannabis, I think, is making the public health argument that much more difficult, to be honest, as well as adults.
Mm-hmm. Absolutely. Thank you for that answer. We have another one here. After the hash oil explosion and fire on Bong Row in LA a few days ago, I'm wondering what kind of protections are needed for use of solvents to create concentrates, storage, and transportation.
You know, I'm not an expert in butane hash oil or solvents. I mean, it's incredibly risky and dangerous. And, you know, I can't really give any sound advice, like what would be best practices in extracting these chemicals, you know. I mean, it just, I think what it shows is that, and, you know, these explosions are happening with greater frequency. You know, people shouldn't be doing this stuff at home. This is lab-based work. But you know, I don't necessarily know of any recommendations to make it safer other than to not do it at all.
Yeah, just YouTube butane concentrates, and you'll never want to experiment with that. Here's a question. Do you know of any studies regarding the health effects of cannabis use outside of the United States?
I've seen articles, Canada and Israel, where cannabis is legal, but they have a strong, fairly strong research infrastructure. I would look to the literature there.
Israel and Canada. And if anyone has a particular research question or is in need of access to a paper that they don't have access to, you're always welcome to email me, and I'll do my best to find that for you. Another resource we have, we recently, within the last year, recorded a speaker series on the regulation of cannabis and cannabis products, and that can be found on our YouTube page, and it goes into a little bit more depth into the regulation needed. Dr. Wayne Hall has done comprehensive reviews outside of the US, so he could be somebody to look up, according to Dr. Pakula. Thank you.
Thank you. And folks, feel free to email me as well if I didn't get to answer your question.
Yes. We also have a comment that extraction distillation using ethanol as the solvent is safer than butane.
Yeah.
Okay. Those are all my questions. Does anyone have a last question? You can raise your hand. We have time for one or two more. I don't see any coming in. So I just want to thank Dr. Steinberg for an excellent presentation and the time you put into putting this together and spending it with us today. This recording will be available on our YouTube page by the end of the day, so please share it with your colleagues and community members who you think might learn something from Dr. Steinberg. Again, stay in touch with me and Dr. Steinberg, and be on the lookout for our next virtual lecture series on Tuesdays at noon. Dr. Leventhal, did you want to say anything?
No. Thank you, Jane. Great
Sure.
talk. And
Thanks,
great questions
everybody.
from the audience as usual.
Thank
Yes.
you, everyone.
Thank you. Everyone have a great afternoon.